Hi, I'm Dr. Christopher Steiner. I'm a chiropractor. And in this video, we're going to talk about peripheral neuropathy. Peripheral neuropathy is where we get the burning and the tingling and the pain in your arms, legs, hands, and feet. It's a very common problem to have that people in America suffer with, and I want to talk to you a little about how we help people get better and what makes us different from every other doctor you've ever seen. But first, I want to talk a little bit about myself. I've helped over 500,000 people. I've created rehab hospitals in New York City. I used to have a neurologist work for me, an anesthesiologist, a cardiologist, a physiatrist, internal medicine doctor, physical therapist, occupational therapist, other chiropractors as well. And what I've learned is how to really help people who suffer with these chronic conditions and get them feeling better, okay? I've personally trained under Dr. Michael Johnson, the author of this book, what to do when the medications do not work. A non-drug treatment to dizziness, migraines, fibromyalgia, and other chronic conditions. Very important read. So, what makes us different from every other doctor you've ever met? Well, first of all, we treat patients both metabolically and neurologically. You are watching this video today because either you or somebody you care about suffers with peripheral neuropathy, and you want to get some answers to it. You want to know why the medications you're taking aren't working. How come you still have these pains and problems after you've been to multiple doctors? Well, I'm here to tell you that I will leave no stone left unturned to find the exact cause of your peripheral neuropathy and why you're suffering from this. I will guarantee you that no one has told you what I'm about to tell you. So, how do I successfully help patients who suffer with chronic conditions such as peripheral neuropathy? Again, by using specific metabolic and neurological testing and treatment, we're able to help people get rid of these problems and help people get feeling better. So, first thing we want to do is do metabolic testing to find out the exact cause of this problem. First test we're going to run is a complete thyroid panel. Now, a lot of people go, I've been to doctors, I've had the test run. Well, there's different ranges in testing. Let's take the thyroid for example, just a simple thyroid stimulating hormone panel. Normal ranges is from 0.5 to 5.0. But functional range, for the thyroid to really function correctly, has to go from 1.8 to 3.0. So there's a big disparity in what is the correct range. And functional range is what we're looking for. We want to make sure your body is functioning the way it's supposed to. So we need to do a thyroid panel. We don't just check thyroid stimulating hormone, we check actually 8 different panels. Because if your thyroid is not working correctly, the thyroid is the gas pedal for your metabolism and your whole body's cellular function. So we need to make sure the thyroid is working correctly. Complete metabolic profile. We have to check your electrolytes, your blood sugar, and other markers that indicate any disturbance in the physiology of your body, how your body is working. We want to do a lipid panel. We want to check cholesterol, LDLs, HDLs, because these can all relate to endocrine dysfunction. We need to check you from head to toe to really make sure we find the exact cause of your problem. So we have to run the test. We want to do a complete blood count. This will check your cell counts, your white blood cells, your red blood cells, and so forth. So it's a specific breakdown of certain white blood cells that can indicate an often overlooked pattern in endocrine change. We can assess your thyroid, your adrenal glands, your liver, your kidneys, your red and white blood cells, your gut function with the above tests, because all internal functions can be affected with chronic health conditions, meaning your liver is not going to work correctly if you have these chronic pain and problems. Peripheral neuropathy is a chronic condition, so we want to check to see what else is being affected. Sensitivity testing. This is critical. Sensitivity testing is very important. We need to know if your body is sensitive to certain things, such as gluten, such as eggs, such as soy, such as yeast, such as milk. Okay? If you are sensitive to any of these food groups, it is making your condition worse. It's making the peripheral neuropathy worse. Why? Because you might be suffering from an autoimmune disease, where your own immune system is attacking itself. So, some symptoms is chronic pain and fatigue. Well, peripheral neuropathy is chronic pain, right? Frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers, and sores. The only way to know if you are sensitive to this is to run the test. We have to find out if you have these sensitivities, because if you are, and you're still taking gluten in, say you're sensitive to gluten, you're never going to get better. We need to fix this problem correctly, okay? Adrenal stress index. Your adrenal glands are glands that sit right above your kidneys. They are your stress glands. Your adrenal glands control and have a direct relationship with your cortisol levels. So we can further test your adrenal glands by doing a saliva test. And if you are suffering from insomnia or blood sugar issues, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia and no problems with your blood sugar. So cortisol levels can be corrected via specific nutritional protocols. Your cortisol is critical for your sleep patterns, also critical for help healing. So we want to find out what's going on so we can heal you faster. Immune panels. Immune panels are very important. Your immune system has two sides to it, a Th1 and a Th2. It works like a seesaw. It has to stay in balance. If you have one side that is dominant, it could create major problems. If you have the other side that is dominant, it could create other different types of problems. So we need to know what side is dominant, or if it is in the balance, which is called homeostasis, and that's where we want it to be. We want to try to have the whole body balanced. So you could be suffering from an autoimmune disease. An autoimmune thyroid is called Hashimoto's thyroiditis. Your immune system could be attacking your own thyroid, for example. So it's very important that we run antibodies to find out, too, if you do have an autoimmune disorder. So let's first talk about the Th1, Th2. Th1 is your T cells. Your T cells are the army that attacks the cells. It attacks antigens, it attacks bacteria, it attacks viruses, it attacks parasites, things that are in your body that's not good for the body doesn't want to attack. Those are the T cells. So that's Th1. So to find out if you're what's called Th1 dominant, we have to check interleukin 2 and TNF alpha. If they are elevated, you are Th1 dominant. So that means your Th2 is not dominant and it's being suppressed. Now Th2 is your B cells. Your B cells, they make the antibodies. They tell the T cells what to kill. So if you are Th2 dominant, the body is attacking cells, or it's marking cells to be attacked. So we need to make sure it's in perfect harmony. So we get the marked cells to attack, plus the right amount of cells to attack them. We got to make sure it's back in harmony, back in the seesaw action. Th2, to check that, we're going to look at interleukin 4 and interleukin 10. These are your natural killer cell activity too we want to check. All right? So we want to determine if there is an active antigen or dysregulation. How is the immune system working? Is there something that's actually creating this stimulation? So an active antigen could be a parasite, bacteria, virus, mold, yeast, fungi, protozoan, foods, chemicals, even heavy metals people could absorb. And we all heard about lead paint chips and stuff like that. Well, we have a lot of toxicity to metals in the environment that we live in. So the best indicator for an active antigen as the cause of a patient's abnormal dominance is the helper-suppressor ratio of the T and B cell panels. So it's called the CD4 and CD8 ratio. We want to check for intestinal permeability, another thing that gets affected when we have chronic conditions. Your intestinal permeability will lead to a leaky gut syndrome. This is a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, infections. All can lead to this breaking down of the gut wall. So therefore, your intestines isn't able to absorb food and nutrients correctly. And it leads to toxins and more chemicals getting infiltrating to your body, which is not what we want to do. So we need to check your neurotransmitters. Peripheral neuropathy, this is huge. If your nerves are not transmitting signals correctly, how is it going to function correctly? If the brain's not being able to send the correct signal down through the nervous system, where do we go? Why do we do this? So we got to check the neurotransmitters, make sure the transmitters are functioning correctly. We got to check hormone panels. We check your hormone panels to determine if patients suffer from low testosterone in males, low estrogen and progesterone levels in females. Symptoms of low testosterone and hormones can be depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, inflammation. Inflammation is critical. We have to check if you have inflammatory problems going on. If you have peripheral neuropathy, very high probability you do. So again, we need to check everything to find out the exact cause of your problem. Why do you suffer from this peripheral neuropathy? And that's what we want to do. So we're going to do specific neurological and metabolic treatments. Now, with the treatments, first thing we want to do is get you on some glutathione. Glutathione is the mother of all antioxidants. It can help so many areas of the body rebuild and restore itself. And that's what we want to do. Get that nervous system functioning better again. Get rid of that pain and that burn sensation that you're feeling in your hands and feet. So the other thing we want to do is oxygen therapy. The brain needs two things to survive. It needs fuel and activation. Fuel is glucose and oxygen. Activation is specific neurological, is stimulating the nerves. So we do that by doing specific neurological treatments to stimulate different areas of the brain. And that's why, again, I said, we treat you both metabolically and neurologically. So the glucose falls on the metabolic part. The oxygen and the neurological stimulation falls on the neurological aspect of what we want to do. So we've got the right hand and the left hand, the metabolic and the neurological side of the treatment and testing that we have to provide for you. We use oxygen with exercise. Okay? We use a special upper body ergometer. We want to stimulate specific pathways of the brain. We're going to use vibration therapy that works the dorsal side of the spinal cord. We want to get that cerebellum function correctly. We want to make sure the mesencephalon is not overfiring, because that will lead a lot of times to the peripheral neuropathy and these other chronic conditions. We use vibration therapy, as I said. We use auditory, visual, olfactory stimulation, spinal adjustments, extremity adjustments. There's many different things we need to do to stimulate that brain and get it to function correctly. Back to the oxygen therapy. After the age of 25, the body's ability to use oxygen in the brain decreases at 1% every year. So if you're 50 years old, you've already lost 25% of your ability to use oxygen in your brain. So we need to restore that. Now here in Colorado, we live at altitude, so we even have less oxygen. The brain needs 98% oxygen to function correctly. So we need to really make sure the brain gets enough oxygen to function and correct these problems. So again, we treat patients both metabolically and neurologically. I'm not going to tell you to stop taking your medication. That is not my job. That's your medical doctor's job to monitor your medication, stuff like that. I'm not going to ask you to not go to your medical doctor. I don't believe in that. I believe you have to go to the medical doctor and get taken care of as well. So, but I need you to ask yourself a few questions here. First, how has your peripheral neuropathy affected your job, your relationships, your family, your activities, and your finances? What has it cost you in time, money, happiness, and sleep? Where do you picture yourself in 3 years if this condition is not taken care of? And more importantly, what is it worth to you to get rid of this condition? Now, the reason why I ask that is I only want to take serious patients, people who really want to get better. So if we run the test on you and we find out you're sensitive to gluten, and you still want to eat gluten, you're never going to get better. So it's not, I don't want to waste your time and my time to try to help get you better if we're not going to be able to be on the same page. I want patients who really care about themselves and want to make a difference. If you really don't care, if you just want to go and take different medications and keep getting the same results that you are getting, that's fine. This office is not for you. If you really want to get to the cause of your problem and fix it, I can help you, again, by treating you metabolically and neurologically. So, what I would like for you to do is call our office, 303-660-2668. Again, 303-660-2668. Ask for an information packet about peripheral neuropathy. Get all the information, get the forms filled out. We'll invite you into the office to give you 2 free visits. The first visit, I'll go over all the information that you filled out. Do a screening on you, see if you're a candidate for the program. Then I'll discharge you on the second visit. You come on back. I'll let you know if I decided to accept your case. I can only accept maybe 4 or 5 peripheral neuropathy people a month. So there is a bit of a waiting list, so don't delay. If I accept your case, I will go over everything that we need to do, and we'll get the ball rolling and get you feeling better. Thank you. Look forward to seeing you soon.